So, and I guess the question is, would there be a patient, Jennifer, that you were seeing that was coming to you for surgery after 3 cycles of TCHP or THP, where the response was like less good? Would you go back because you're worrying about how much surgery you have to do, et cetera?
Yes.
What would be your thoughts there?
It's always a good discussion with patients, also driven by some of their preferences, and hopefully how much we can de-escalate potentially more morbid aspects of the surgery too. Someone who is really aiming for breast conservation therapy, we're really looking at how much residual disease they may have on post-treatment imaging. Also, if they have node positivity, trying to get them to hopefully not need an axillary lymph node dissection is really key as well, looking at that post-imaging to see what are their responses after 3 cycles, 4 cycles. I prefer to see my patients about halfway through their neoadjuvant regimen, really getting a sense of the trajectory of their treatment. Also now, with these pivot points in systemic therapy, it's really helpful for me to catch up with the medical oncologist, understand, are they thinking of a THP, T-DXd, a T-DXd to THP, like THP to escalate further approach with these patients with HER2 positive disease, because we know it's the systemic therapy is so key. But what I can do is make sure that I can reduce as much morbidity, talk to patients to make sure they're ready if we do need to escalate to more extensive surgery as well.
Yeah, so I think that's such an important point that, as oncologists, we need to be interacting with the surgeons and have the patient see the surgeon halfway between their neoadjuvant regimen and keep that open communication so that we coordinate well so the patient doesn't come and say, but the surgeon told me.
Yes, much
whatever it is.
Multidisciplinary management at the back.
Exactly.
Yes.
So, so then, and I guess, if you have more PCR, you might see more breast conservation.
Absolutely, yes.
Which is a big benefit.
As well. A huge goal, I think we now know that really mastectomy is not proven to be more beneficial in all ranges, ages of women. So the option for breast conservation therapy is so important for women in a lot of their quality of life, their sense of self. So being able to offer that for those who are interested in breast conservation therapy, this therapy can get them that. And